Hi there, my name is Andia Comstock, and I am the Director of Activities and Volunteer Services at HCHA's Long-Term Care. What we're discussing today is how to enhance the well-being for our residents utilizing aromatherapy. We will review what aromatherapy is, single oils versus blends, evidence-based effects, methods of applications, contraindications, resident consent, the binder, and all that good stuff, the nitty-gritty, product storage, and charting. Quick introduction to aromatherapy. The definition is the therapeutic use of plant-derived essential oils to promote physical and psychological well-being to our residents. How it's made. So essential oils are a very concentrated plant extract. They are used to enter the nervous system through inhalation or topical application. We'll learn more about that. The effects on the brain. So the sense of smell is very powerful. It's linked to the brain's emotional centers, and it makes a very unique tool for affecting resident mood and memory. So for a quick understanding the difference between single oils and a blend, the single note oils are going to be exactly what they sound like. In the picture here, we have ginger, so the oil will be ginger. Whereas the blends, which is mainly what we're going to be working with in our long-term care, this example specifically is our anxiety rescue patch. And you can tell by the ingredients, there's a variety of essential oils listed there. The purpose of having a well-balanced blend is that not one single note is overpowering the others. And the problem or the risk that you run by doing single note oils is negative scent associations. So a really great example is if someone was going through chemo and they had a lot of nausea vomiting, maybe they ate some ginger candies and that helped them at the time. However, now years down the road, the scent of ginger brings them back to that memory and does elicit that physiological reaction of nausea and vomiting. So we're trying to avoid that. And so that's why you're going to see a lot of blends in our long-term care, whether it be utilizing the patches or the massage oils. We're going to get a little nitty-gritty, but stick with me. So we're going to talk about evidence-based effects. The reason why we are so passionate about non-pharmacological approaches is because this is research backed. Proof is in the pudding. So just in PubMed alone, there's over 2,400 research articles that show the correlation of aromatherapy in healthcare systems and positive patient effects. The main two that we're kind of looking at within our facility is decreased anxiety and improved sleep. So for decreased anxiety, you could just go to PubMed and look. There are many meta-analyses that suggest aromatherapy with a variety of oils can help a resident alleviate their anxiety signs and symptoms regardless of the cause. So flipping over to the next one, improved sleep. Sleep quality with aromatherapy did show significantly higher results in these studies. So if we have a resident who maybe just has a really hard time settling down for the evening, she's up until 2 in the morning, maybe implementing an aromatherapy patch after supper when it's kind of starting time to wind down, maybe 8 p.m., get her into the routine of brushing her teeth, getting into jammies, and she's going to be smelling the blend of a calming, relaxing aromatherapy patch, and that could help to increase her improved sleep quality. So methods of application, we have two methods within our facility, aromatherapy patches and infused massage oil. For the aromatherapy patches, I want you to write this in a bold red marker that they must not go through the laundry. If a resident's top goes through the laundry with a patch on it, it will gunk up and it will ruin the top. So please be very mindful to take off the patches. This is a long-term care staff-led intervention, so you're going to be having CNAs, TMAs, nurses, activity aides applying the patches. The patches will last about 8 to 10 hours, which is really wonderful. Then on the right, we have our infused massage oils. So a couple examples of what we have in-house is the calming and the comfort. We also have some other options. This is stored in activities and mainly is led by the activity aides. The purpose of this is hydrating the skin, but also providing that topical application we discussed earlier without having to have them smell the scent all day. There is a noticeable difference in how long you smell the fragrance. The patches, again, are 8 to 10 hours. I would say the massage oil is more of like that 30 minutes to an hour mark. If you are interested in giving it a try, stop by my office. I'm in the activity department, and I'd love to let you try it on the back of your hand, and you'll kind of catch on that the scent goes away after about 45 minutes or so. Examples of when we would utilize this would be during nail care, movies, restless residents during bingo. The most important thing, though, that you guys need to remember is not every resident has consented to aromatherapy. So we will be reviewing where the binder of consent forms is stored because we can't apply a product to a resident who hasn't consented. So for contraindications, there are so many reasons why someone would not be a good candidate for aromatherapy. It is our responsibility as healthcare providers to be aware of each resident's needs and what might contraindicate their participation in the aromatherapy program. Lucky for us, we have some really great charge nurses who do a consent form upon admission. So if you're looking for, hey, does this person qualify, not qualify? Look at our binder at Central Nurses Station, which has the consent forms there. You'll be able to see, hey, did this resident consent, yes or no? But I just wanted you guys to be aware of the why someone might not be a candidate for aromatherapy. Resident consent binder is stored at the central nurses area pointed at by that giant red arrow. It is the responsibility of all long-term care staff to be aware of which of their residents have consented to participate in the aromatherapy program. Looking on the right-hand side, the consent document does itemize inhalation by patch or skin absorption via massage oil, or if they're declining. At the bottom, we note any allergies or conditions. An example of a condition would be a resident who has a prescription ointment or cream that is topical, which would contraindicate them participating in the program. So please be really diligent about checking this until you feel comfortable and have learned which residents are in the program. Product storage. This is super important to keep clean and organized so we're all on the same page shift after shift. As pointed out with the giant red arrow, there is a hidden key. This hidden key is in each of the east and west cubbies and unlocks the aromatherapy cupboard. In this cupboard, you're going to notice a folder and a couple acrylic storage units for the patches. Within the folder, it is your responsibility to document on paper and the computer. So the first thing you're going to see in this folder is a cheat sheet. If a resident is having some sort of behavioral expression and you don't know the patch to meet their needs, that's what the cheat sheet is for. Then the next page is going to be how to document on the computer because sometimes that can get a little iffy, and it is so important to document that you put the patch on and that you took it off, or that you did the massage oil and if it was effective, not effective. Then after that, we have the paper charting. The paper charting is for which type of product you used. Was it the anxiety rescue? Was it the calming? You'll do the time, the resident name, and your initials. So then we're able to keep track of the time it was administered on paper, because should something go wonky and the computer charting isn't happening, then gratefully we have the paper charting to back up, but we must be doing both. Last thing for us to talk about is charting on the computer. You guys are on your home stretch. So charting application, it is so important to specify which product you are putting on. We don't have any of the single use oils. Okay, so if you see chamomile or you see lavender, anything like that, that is not a part of our program. So you need to click other, and then you need to specify what you're using. Is it anxiety rescue? Is it calming? Is it rest? Is it grounded? Is it lucid mind? The reason for use. Please select whatever applies. And then in the information section, that's where you're going to note the additional information. What are you objectively seeing? What was additional interventions that you tried? Did they need to use the restroom? Did they want to walk? Were they feeling nervous? Did they want to participate in an activity as well? What are things that you're seeing? Last thing is charting removal. So the patches can stay on for 8 to 10 hours, but follow up for the effectiveness of the aromatherapy after 30 minutes. Again, you're going to go back to the exact same place you did the aromatherapy assessment, selecting other, typing in the flavor or the scent that you applied. Again, was it calming? Was it grounded? Was it lucid mind? What were you using? And then in the information box, noting the anxiety rescue for this example was removed. The resident had calmed, is cooperative with staff without signs of anxiousness. The resident is out for supper and no distress is noted. The goal is to see, is it effective, yes or no? If it's not effective, why? If it is effective, what are you noticing? If you have any questions, please feel free to reach out. Again, my name is Andia. I am the Director of Activities and Volunteer Services. This is such an exciting program, and we are really blessed to be able to incorporate this and offer this to our residents as a non-pharmacological approach. So please think of this when you're experiencing some behaviors, exit seeking, maybe some wandering and some anxiousness.